Hey guys, welcome back to Mom Talk. This week we wanted to talk about our spinal health. A lot of the times I feel like spinal health gets swept under the rug as we take care of things like our dental hygiene or dental health and all these other things that we go to the doctor for. But spinal health and spinal hygiene is so important, especially younger, so that we can set ourselves up for a really healthy lifestyle in the future.
It's very important these days because unfortunately kids are on electronics, so we're always looking down. At school, we're always looking down. So we're always waiting till these kids have a problem to start thinking and taking care of the spine. But we need to really be proactive, like Dr. Chloe said, like taking care of your teeth. You take care of that every day. We need to take care of our spine every single day to help these kids be healthier.
Right. And even if you're not a kid or you don't have kids, I mean, a lot of you guys work at your computer. That's a big deal. Or if you work in the car and you're like leaned over driving, like that's not great for your spinal health either. All of this plays a role in how we function day to day, plays a role in our sleep, in, how we are able to really like do everything else, digest food and in all of that. So
No, and I am losing my voice, but I feel like for us too, being chiropractors, well, I feel like we use our bodies like as our jobs. That's also hard on our spine. So getting adjusted for us too is super important in that kind of area as well.
Right. Yeah. Even with adults, I usually ask what their job is because it's such a repetitive motion that we're doing repetitively throughout the week. So, yeah, even if they're not sitting at a desk, I always think about hairdressers. They're standing all day. Their arms are raised most of the time. That affects spinal health too. So, all these repetitive motions that we're doing, even stay-at-home moms, picking up babies, picking up laundry, all this stuff plays a role into our spinal health and our spinal hygiene.
Yeah, even how you sleep. Unfortunately, we hear or we see people that are sleeping on their tummy. So, we don't have a hole in the bed. So we're always turning your head. And we're like this for 4 to 6, 8 hours. Again, if you don't undo what you're doing all day, all night, you're going to have problems with the spine. And of course, everybody knows problems with the spine is neck pain, back pain, but it's so much more. Your spine protects and controls your nervous system, which makes your whole body work. So if you want health, you've got to take care of your spine every day.
So what do? We get adjusted first and foremost, all of us, at least once a week. I think that's what we do for a job that is absolutely essential. Making sure that we're staying hydrated. You'll see each of us with water all day long or, whatever else. Making sure that we're eating healthy. That is such a big deal. Things that we put in our body really affect the inflammation levels of our body. And when we have inflammation around our nerve roots and those nerve roots are irritated, they're going to affect everything that our body does. So those are big three. Um,
Also, I have a renoodle, which a renoodle is almost like a foam roller for your spine. And laying on that and doing a lot of extension exercises on that. We also have demi rolls that help with the curve in your neck. I actually have a home neck traction, a little bit more aggressive, but the demi rolls are just the same. Like we said, you get up, you brush your teeth every day. And these are little bitty bones in your mouth that, yes, they're important. They chew your food. But these big bones we got to take care of every day too. And so if you have something, some kind of tool, a demi roll or a renoodle to help you do that every day, and just like you brush your teeth every day, will be very good.
There's nothing I love more than getting home from work and laying on their noodle. Honestly, it feels so good to, counterbalance everything that gravity takes a hold of and makes us go into this position. The noodle will counterbalance that and help with that really good posture, even opening up the pecs and all that good stuff. Um, Working out is one we haven't talked about yet. Whatever kind of workout it is, all of that is going to contribute to spinal hygiene. I personally like do Pilates and yoga and run a little bit, but I think any movement for the body is good. That's what I always tell people. They'll ask like, "What's best?" And movement for the body is the best medicine.
And stretching.
And stretching.
We have a couple of stretches that we try to give everybody here. to stretch the front of your body and strengthen, because unfortunately we're always like this. So we want to stretch this area and strengthen. So doing those light stretches every day. And I tell these people, those stretches probably take about 15 minutes to do all of them. I don't have 15 minutes, but if you break it up and, when I'm on my bike, I do my neck stretches. So, like, doing these daily stretches every day and putting it in your daily routine is so important to take care of your spine.
Yeah.
Maddie, you should talk about upper limb syndrome.
Yeah.
Speaking
Maddie works out a
especially
lot.
working out.
Yeah, I try to work out 6 days a week. So my body also is just kind of going through the ringer for those 6 days. So stretching a lot, especially, I mean, I deal with upper cross and lower cross syndrome a lot. My posture is also not the best, but I have weak muscles that I have to strengthen, and I have muscles that are super, super tight that I have to stretch. And that's exactly what upper cross syndrome and lower cross syndrome is, right? So stretching is super, super important for those also, because I mean, everything plays a role in it, right?
Mm-hmm.
So working out, I really try to hit the muscles that are super tight when I'm working out to make them stronger. And then when I get home, I also try to stretch the muscles that are super tight. I said, yeah. So that way they kind of stretch out, they can relax, they can kind of make sure my posture is always on point and everything like that. So super important for our spinal health and then everything that we do with it.
Right. Another thing that I do is a lot of people will do like Epsom salt. I do magnesium baths, which game changer. Game changer. Magnesium is super important for your muscle relaxation to happen. If you are deficient in magnesium, which most people are, our muscles are going to stay contracted, which is where you get those muscle knots and where you feel like you just have to kind of like do this thing all the time. Magnesium baths, I do those at least once a week, and sometimes I'll fall asleep on accident in there because it just relaxes me so much.
What about the magnesium lotion?
Oh, I love it. It's just magnesium lotion. That's my thing too. Really good for pinpointing and targeting muscles. So, for example, like if you get a Charlie horse, super great to put that magnesium lotion on it during your Charlie horse, but even like before you go to bed, really, it will help with sleep. It helps with allowing the body to relax, and it takes it from, like, a lot of people take magnesium orally, and that's great. It will go systemic, but this magnesium lotion will help your body right where you need it. And you can put it on as many times a day as you'd like, but it just causes that muscle to relax. So it's more targeted than like an oral or a magnesium bath. So if you have, like, I have the shoulder issue that's going on right now, there's magnesium on that every single night before I go to bed, just to try and get that muscle to relax.
Oh, and her talking about these muscles up here, which is a big part of my issue too, because I'm a chiropractor and I'm over the table. I keep a lacrosse ball in my car, and every time I'm in my car, I'm lacrosse ball working on those muscles in my upper back and lower neck. And that's really helpful too, for helping, my posture and my spinal hygiene is really working on those knots every single day. And again, we just got to get back to this whole working on yourself every day, like you brush your teeth every day. So getting these kids doing these stretches every day, they're going to grow up knowing how to take care of their spine, take care of their body, because they have to stretch every day. I know I didn't grow up stretching every day, and so I think it's very important get your kids in this routine of stretching every single day, because we're on these phones. We're, all school is on computers now, so they're looking down like this. So, we really have to teach these kids how to stretch every day.
It's like true generational health, which I think is so cool.
Absolutely.
We get to pass this down for generations and generations to come, and it starts with us.
Yep. Or what about, like, Chloe, you were a dancer and you played soccer, and I was a cheerleader and a gymnast, and you played sports, all sports. Like, I can't even pinpoint one, right? And I don't know about y'all, but it was not as competitive as these kids are doing these days. Like, I mean, I hear kids who are like training 40 hours a week, like it's a full-time job. And, we just said that we weren't taught how to stretch and how to fuel our bodies and how to take care of our spine, how to work out, proper form, right? And getting adjusted and taking care of our spine is a part of that. And that's what we're here to do is be able to teach you how to take care of that and also still be able to train the way that you train safely, right? So we don't have adults that have these chronic issues that stemmed from when they were 12 years old and they danced competitively, or they were a super high level gymnast or a football player or a wrestler.
You're right, because we want them to be able to do that high intensity training, but you have to do more these days. You have to stretch, you have to get adjusted, you have to do all the things because we're just doing more and more these days.
Right. And part of that is a big part of that is diet too. These kids who are working out a lot, yes, a lot of them have great diet, but a lot of them also are eating junk because they're getting high calories really fast and they feel like that's fueling their body, and then they crash. And that is going to create inflammation in your body, around your spine, dysfunction everywhere. So a clean diet, really a lot of hydration and movement.
Mm-hmm. Any other suggestions?
If y'all have questions, please leave them in the comments. We are going to be answering them. Each time that we do this every month, we're going to kind of toy with, are we going to do this live? Are we going to do it as a video and answer comments? And so if you guys have any suggestions or any way that you would prefer that, you let us know. We'll be happy to kind of play around with this and see how we like it each month.
And we are doing this for you. So if you do have questions, we'd love to hear, give us a message. We actually have a little box up here that you can put into a question in there. We'll get it. You can Instagram message us, Facebook message us, call us, let us know. But we do want to do this for you. So we do want to hear from you, and we would love any of your input. But we are doing this for you. So just let us know.
We'll put a little question box too, like in our stories, that you guys can answer if there's anything that you want to hear about on this panel next time or the next time or whatever. And if we have to do this more often, we will, but we're kind of just playing with it. So, okay. We'll see you guys soon.
See ya.
Bye.